The Cars for Key Workers program from Sixt is getting key workers like doctors and nurses where they need to be, all while sparing them the risks associated with taking public transportation during the pandemic.
It's providing cars, rental cars at cost price, basically just covering our basic overhead cost for key workers, and the main focus is on the doctors and nurses that are commuting to and from work, many of them unavoidably by public transport on a daily basis because they are maybe working in a city, they're living in the city, and so as a result, that by providing them cars, it keeps them away from the subway, from the buses. I mean, this week it was reported that in the last few weeks, 21 Transport for London workers have died as a result of COVID-19, which is really, really sad, and it is really actually unforgivable because they haven't received the same protection as our health workers have. And but naturally, what does it mean? It tells us that if 21 Transport for London workers have died, then really, do we want our health workers to be using public transport and being exposed unnecessarily to that risk? Clearly not. And we need those health workers to be on the front line. We can't afford them clearly to spread the virus, and moreover, to be away from the front line, but also being at home self-isolating, or indeed taking the virus back to their families. So anything we can do to provide cars for key workers, that's basically what we've done. We've been working on the Cars for Key Workers campaign across many different countries. In Germany, the state government actually, for one of the regions, created a €1 million fund to basically donate that money to Sixt, as well as some other rental car companies. In the end, we're not in a competitive environment at the moment. We're really in an environment to help stop the spread. And I think that set a very good tone. In the US, we've been doing the same in different states, reaching out to the health authorities, private hospitals, in order to do very much the same thing. And whether the health authorities are paying the bill, whether the government's paying the bill, whether a charity is paying the bill, the most critical point is to make sure that our key workers, our health workers, are transported safely to and from the workplace and back home again, exposing them to as minimal risks as possible. One thing I would like to leave you with is again the thing that I'm the most attached to and feel passionately about is the topic of cars for key workers, because these people do such an incredible job. I learned the other day that our health service in the UK hasn't received a pay rise in 4 years. And my mum used to be a nurse for, 40 years. And so it resonates, very passionately with me. And, what we haven't yet executed, but we are strongly contemplating, is the idea of starting up a fundraising campaign ourselves that would raise money for us then to be able to gift car rentals and taxi rides through our application for free, funded by the kind donations of our network. Basically, we have a lot of friends, colleagues, and above all else, very large corporate customers, which we hope, would be able to reach deeply into their pockets and recognize that this is, a heartfelt campaign for all of our health workers. And whether that's a national campaign or even an international campaign, we would make sure, obviously, that the money that would be generated in each country would go directly back to that country. Yeah, we're strongly contemplating that right now. And if anybody out there watching this is interested in supporting us and maybe helping us to get that off the ground, or has any ideas about how to do that, I would be, eternally grateful, because in the end, we're all in this fight together.